One of the things I'm interested in is international environmental health. And one of the opportunities I recently had was to go to the country of Liberia on the coast of Western Africa to take a look at water quality issues there in the country. Liberia has recently come out of more than a decade of civil war. The country is rebuilding itself and trying to put infrastructure back into place. But water wells are the primary source of water for most of the population, and the quality of those wells is not certain. Public water is not available yet, especially in metropolitan areas. What I was looking for primarily was I was looking for nitrates and nitrites, which are problematic in well water because they can affect the health of young children. And I was also looking for bacteria and fecal coliform in the water, which is an indication of the impact of human waste on the wells. And so what I found was that virtually every well was positive for bacteria. That's not to be unexpected, but so many of the wells were affected by coliform bacteria, which is an indicator of specifically, human waste. And there were some wells, especially in some of the high density areas, that not only tested positive for bacteria and coliform bacteria, but also had very high nitrate levels. The problem with that is you boil water to kill the bacteria, but boiling the water actually concentrates the nitrates. And so it's not a simple solution of adding bleach or boiling the water. If you just have bacteria, that's the solution. But if you have both bacteria and nitrates, that becomes more problematic in delivering a public health message that the people can actually apply. Bacterial contamination of drinking water shows that the water itself is very susceptible to other types of contamination. And so disease outbreaks can move very rapidly through an area where the water is so vulnerable. And with so many people present in some of those high density areas and everybody using those wells as their primary source of drinking water, there's a significant risk of a major outbreak in a community like that. Liberia has very close historical ties to the United States, and it's an English-speaking country as a result of that. And I had the opportunity here in Springfield to meet many of the Liberian people who fled the country during the war and came to have a good friendship with them. So Liberia has always been a country that's interested me. I'm currently teaching a course on global health, and so I'll bringing in information on that. I teach environmental and occupational health, and so when we do issues on water quality and sewage, I'm using Liberia as an example of comparing their system with how we do things here in the West. And then when it comes to public health policy, although our focus on public health policy in that course is Illinois and United States policy, I try to bring in some of these international perspectives to help them understand that what may be a policy emphasis here in America may be completely different in other parts of the world. So it's been a wealth of material that I think has helped the students get a broader perspective on these issues.